Nurses should be interested in becoming certified because it helps them to demonstrate their knowledge, their skills, and their abilities that tell both themselves, their employers, and their patients and families who they're caring for that they really are qualified and have the competencies that they need to deliver excellent care.
One of the big things in being talked about is the consensus model for APRNs. What specialty do you foresee being the greatest in demand in the future?
Care is transitioning to primary care, and the greatest demand I foresee being the nurse practitioner role, which is growing very rapidly, and primary care or family nurse practitioner actually being the one that's needed most in underserved areas, rural populations, because nurse practitioners are really passionate about delivering care to the underserved and willing to go into areas where other professions that deliver provider care might not be willing to go into.
We've heard a lot about nursing shortage, but there's also a doctor shortage. A nurse practitioner can extend that care. And there are various specialties within the nurse practitioner. What are some of those specialties?
You know, the APRN consensus model really helped us to organize all 4 APRN roles: nurse midwifery, the nurse practitioner, the clinical nurse specialist, and the nurse anesthetist. But for NP in particular, they define the population, and so they have pediatrics, adult gerontology, they have women's health, psych mental health, and so it's a spectrum of possibilities.
Well, that opens it up to the whole age span.
Well, the research does tell us that more and more nurse practitioners are entering specialty practice areas. So while they may be an adult gerontology acute care nurse practitioner or an adult nurse practitioner or family nurse practitioner, they may be drawn to a dermatology practice or to a cardiology practice, for example, so that certifications could help them gain that extra knowledge.
I'm sure there are some new ones that are coming down, some that you would think that there needs to be certification for. What are some of those?
We have 2 brand new certifications, and everybody's asking what are they? And one of them is the CCRN-K, and the other is the PCCN-K. We now have added this option for adding the letter K at the end. And that's for those nurses who might not still be able to deliver direct hands-on patient care, but they have K for the knowledge to deliver that care, and they actually impact indirectly patients and families who need acute and critical care nursing. They may be teaching that type of nursing. They may be a manager on a unit, for example, with patients who are acutely and critically ill. They could take a test for this, or they could recertify as a CCRN and switch to the CCRN-K.
Really commend you guys for coming up with that. I think that's wonderful.
There are some other new certifications that are out there. Forensic nursing might be something new that's popping up. Holistic nursing, palliative care nursing. So a specialty could crop up just about anywhere because we're at a time in the evolution of nursing. As healthcare changes so rapidly, there's a lot of new roles like the navigator nurse or nurses who are involved with transitions of care. So I could foresee a wide variety of potential specialty certifications just cropping up.
And that's the wonderful thing about nursing. There are so many faces of nursing. It's not just the nurse in the hospital.
There's many opportunities coming available. If they get tired of nursing in one field, there's so many things they could switch to.
Exactly, it is. And I think that makes it such an appealing profession for students who are looking, at what to major in.
And a lifelong career that you can take with you almost anywhere you go.
Exactly. This has been so informative. Is there anything else?
I can tell you that employers are looking for nurses who are certified to hire. Many of the employers are on a journey to raise the standard of care and quality of care and ensure patient safety in the care delivery settings. They want to get magnet status, and so they want more and more of their nurses to be certified. So if they're interviewing a prospective new employee and they're equal on everything on paper, but one of them's certified, they're more than likely going to hire that nurse who's certified because they know that they've met a standard of care that's set nationally that can really ensure quality for patients and ensure patient safety.
Exactly.
And on the certification board, we really focus on patient safety. That's our main focus. When we make our decisions, it's all around patient safety.